Um, do you like the fact that Christian values focus a lot on prayer when someone is in depression? How do you justify that? Prayer is important as Christians as we believe, but how important it is, like totally avoiding the counseling part, consulting with a psychologist, counselor, rather than sending to a prayer home or a church? What do you say on that to our parents? Hello everyone. At a time when we as a society give very less importance to mental health, it has become concerning in our society as we see many people struggling with depressions and with all these mental issues. So it's very important for us today to have a talk with two of our practitioners. They are clinical psychologists and the one is counseling psychologist. So the clinical psychologist here we have Athem, Longkumer, and she has been practicing as a clinical psychologist for the last 9 years.
9 years.
And she has done her master's and MPhils in clinical psychologist from Delhi. And we have Nzan, who has done his master in counseling psychology from Martin Luther University from Shillong.
Yes.
So it's a great privilege for us to have a conversation with them to understand better on the issue of mental health and mental illnesses in our society. So welcome to my show.
Thank you.
Thank you for the invitation.
Yeah. So can you help us understand what is mental health?
I think personally,
Yeah.
to start with, I think we need to first address, our collective understanding of what mental health is. Because I personally feel that has been the biggest barrier when it comes to anything with regard to mental health. Because mental health always equals mental illness, and that have been construed in our mind. But what we need to understand is that while not all has a diagnosed mental illness, absolutely everyone has mental health. We all have a brain that needs to be taken care for, similarly as we do our physical well-being. So I really feel that this is a pressing issue that we all need to get our acts together and do something about this.
Okay.
I think there is nothing more to add to that, but she put it very succinctly. Is that we have this tendency to not understand what is mental health and what is mental illness. Those are very distinct terms. Mental health is the stability of your mind every day. What your thoughts. So, are there any intrusive thoughts that that is just intervening your everyday functioning?
Yes.
But mental illness is totally another form of mental illness. When somebody has a mental illness, most of the time they don't know about it. So that is called psychosis, right? We call psychosis. And the difference between psychosis and neurosis. Neurosis is when you have something, when you have depression, but you know that you have depression. So that is neurosis, you know about it. So there's a very subtle difference about it.
Okay.
Yeah.
So in layman's terms, like when you say mental health, it's the health of your mind.
Yeah.
It's simple as that.
Illness means when you get sick mentally.
Yeah.
So it's as simple as that.
Simple as that.
Yeah. Okay, so when it comes to Naga society, are we taking cognizance of this issue as a practitioner? How are you feeling about it?
I think from my experience, I've worked at the State Mental Health Institute for 10 years. And so I think when I started work, we hardly had patients coming in. It was the severe cases that will come in from the interior parts of Lungleng, right? But I think over the years, it's mostly word of mouth. It's not really awareness and everything. It's really word of mouth. People from the interior will come in, feel better and go back. And people will see that they've gotten better and will bring back people. So we have seen a rise in terms of mental health patients in the past years. I see it hopeful. Yeah.
Okay.
I think the word cognizant, right? The one you brought about.
Yes.
Aware. Are we aware?
Awareness.
As a group of people, as society, are we aware of what is mental health, Nagas, right? In general, but I cannot speak for everyone in general. But from experience, the clients that I have, so from them, when most of them are young people.
Okay.
So the category is there now, that's different. So the older generation are not aware of it. Some of them are, but now our generation, people our age, they are getting to know about it. But that is one thing. Another then, should I, seek help? That is another thing now.
Yeah, that's another. So in order to seek help, one should be able to understand that I am sick. I think it's more or less the same with alcoholism. Unless they admit that they're alcoholic and they need help, they will never go and admit themselves in the rehab. I think it may be same with the case of mental health also. Because as a society, we don't accept that I'm mentally ill, right?
There's a lot of stigma attached to it.
Exactly, stigma attached to it. And sometimes we don't realize I feel like that.
That's
so
true.
Can you tell me like what are the early symptoms of mental illness?
Okay. I think to start with mental illness now, what is mental illness?
Yeah.
It is a mental health condition that can affect an individual's way of thinking, right? Feeling and behaving.
Okay.
Yeah. So when we see that there's impairment in these three areas, then we know that, okay, there's something there. We all do get moments of when we feel like emotionally low or feel like not wanting to do anything. That's quite normal. But when we see it that it's persisting and it is stopping us to do things that we love to do otherwise. Now, so there's like a decrease in energy level, hopelessness, feeling of hopelessness.
Okay.
Yeah, feeling anxious, feeling tired easily. There's sleep problems. There's weight or appetite changes, irritability, avoiding people, not wanting to do anything.
Okay.
Yeah, so what Athem said, this particular word, persistence.
Yeah.
So when I on my first year as a psychologist student, my professor purely clearly as crystal as clear told us that, okay, when somebody comes to you as a client, tell them how long has this been happening. Is it persistent? Because someone may just say I'm depressed, but it turns out he or she is just sad for a short period of time. Now we cannot say that is depression.
Illness, yeah.
Maybe just some form of sadness, that intrusive thought. So the word persistence is very, very important. Okay. Has it been happening for a long period of time? We have to go back to a textbook, like the ones over there, textbook DSM-4 and DSM-5. Now it's 5, So we have to go back. So it has to be happening for
persistently.
Yeah, persistently for a period of time. Only then we know. Oh, okay. Now this is that.
Okay.
This is how I can diagnose you. So yeah, that's persistence. That's the word. That's the word that we need to. Yeah.
So if we redefine further persistence, how do you say? Is it for weeks or days or months, or it could be? What is the characters of of getting persistent in your depression?
Usually, it's like persistently for 2 weeks. That's and the duration for about 6 months or so.
Okay.
Yeah. So that's clinically is how we diagnose the person as.
So when you get that persistence of having, the depression consistently for, or persistently for 2 weeks.
Yeah.
So it could be mental illness.
Yeah, because it starts changing the way that you think, you feel, and you behave.
Okay.
Right? And that is changing the structure of your brain. The chemical structure of your brain is also affected by it.
I see.
And it results in how we
That's
behave.
interesting. So did you guys have that kind of clients, or if you look at the profile of your clients, I don't know whether this will violate the privacy of the clients, but it's just anonymously just mentioning about the clients. What are the persistence level of your clients, their mental depression?
I think a lot has to do with the lack of, now we were talking about the lack of awareness as well, and just that stigma that's attached to going for counseling, right, Nzan? I feel that, a lot of it is because there's the stigma attached to it. So people who come to us, they come to us when it has been persisting for quite a long time, say about a month, 2 months, 3 months. Yeah, and so by the time they come to us, definitely, there's a problem that's been going on for a couple of months.
Right.
But on the other side of it, I think the good thing is that young people are beginning to recognize the importance of mental health. And so we have people, going through or seeing the changes and they walk in for counseling. And early intervention is the most effective, right? And so I would always come back to the point that it's looking hopeful. There are a lot of challenges, no doubt, but amidst all that, it is looking hopeful.
It is always hopeful. So remember that we function, we have created such a way of functioning in our society that as a society we function through shame. Right? Are you not ashamed of it? Are you not what will they think of you? So when they come to you, by the time they come to you, it has been already a few months now. Because they've been thinking about it. Should I go? Right. If I go, what my parents will think of me, my friends will think of me. We think that, okay, seeking help, where something is wrong with me, you know. So by the time they come, because we as a society function through shame, shame culture. By the time they come, it is already persisting. They will not come by the first week or the second week.
Right. So if I have that kind of depression for 2 weeks, that means it's good for me to go and meet the counselor at the earliest.
Definitely.
And have a consultation or counseling
definitely.
session with them.
Please do.
So is depression or mental illness kind of hereditary, or it could be influenced or caused by our environment? What do you think?
Definitely. It can be hereditary as well. It can be situational, environmental factors. And I think a lot of things that we see is also a lot of environmental factors.
Environmental factors.
Yeah, because a lot of people that comes to us, at least for my practice, I don't know about Nzan, but for my practice, I see a lot of people come from dysfunctional family setup. And I might be generalizing it, but I'm talking about the client that I have. So I've been getting. And so it's more like a family dysfunctionality, you know, that causes this.
I think like situational, the time that we are living. So you know, the number one cases in my experience as a therapist, as a counselor, is number one is depression. So if I get, let's say, 10 clients in a month, I guarantee you 5 or 6 of them will be depressed. But what is the reason they're getting depressed? Situational, as in say unemployment. What am I going to do with my financial stability? Now that gets them into depression, and they come, you know, say, what do I do? So situational could be like that, you know, and your choice of living. What are you doing with your dysfunctional family? I don't know. I'm not very sure if it's hereditary. I'm not very sure, but you know, that's
okay.
Yeah.
When I read a report of the survey done by the Department of Health and Family Welfare on mental illness, and the report shows that
here in Lungleng,
Lungleng government, the report shows that people who are below graduation from the report, at the same time, who belong to, who are women, have more tendency of mental illness in Lungleng than other groups. So, as per your experience, okay, which are the group of people that have that become more vulnerable to this mental illness?
Group of age or people?
It could be age, it could be gender, it could be, you know, the type of employment, or it could be anything like which you find as vulnerable from, you know, drawing from your clients.
I think early adolescent to young adult, say roughly 10 to 11 years to about 24, 25 years. I feel that group is they're very vulnerable to mental health issues.
I have read multiples of books on this, and I've come to an agreement with this, that depression is universal in nature. It will hit you no matter how old you are.
Everybody is at risk.
Yeah, everybody is at risk. It doesn't matter how old you are. Like, get this sentence very carefully. It doesn't matter how old you are, depression will hit you in some form. But of course, like, awareness of that I am in depression comes to that, you know, what Athem was just speaking about. So, you know, but when it comes to gender, as I was talking with Athem, you know, before this, that that's a whole different matter now when it comes to gender, because in my experience, like I said, you know, 98% of clients that I receive are women.
Yeah.
I really disappointingly, less men. You know, so that's another whole different matter. But when it comes to gender, in my experience, I don't know about Athem, but you know.
Okay.
I think women are more susceptible,
I see.
to mental health issues because of the demands that are on women as well. You know, you need to work, you need to care for the family, and there's so many standards set for women, and you know, in our society as well. So when it comes to mental health issues, definitely, I think, and worldwide we can see that as well. I think women are more vulnerable.
It's very interesting. I understand the fact that everyone is at risk when it comes to mental illness. However, when you look at the adolescents, they are at the prime stage of their life, and they could be very susceptible, like Athem has said. And when you look at the mental illness or depression the adolescent faces, you know, what do you think are the reasons behind this the depression that adolescents are facing today in Nagaland context?
I think first we need to understand is that the whole brain development aspect of it as well, because because the adolescent stage is where the brain is going through a lot of major remodeling, if you can put it that way.
Okay.
So there's a lot of changes is happening. So physically, emotionally, there's a lot of things happening. So they're more vulnerable to making wrong decisions as well. Yeah, and now with the culture that we live in as well, we have the whole social networking, then we have like the gaming thing, so the young people, there's an onslaught of a lot of things for the young people. And so when their brain is going through major remodeling, they're not being able to, the thinking brain has not yet fully developed. Now they say that thinking brain that is located at the back of our forehead is called the prefrontal cortex. They say that's developed the last. And it develops fully, means the brain is there, but it gets fully connected when you're 25 years of age.
I see.
Yeah, and so we call human as the superior animal.
Right.
But interestingly, we are, I think, the longest to develop fully.
Yeah.
And so that explains why young people make a lot of risky or, a lot of decisions that are not really thinking based, but more of feeling based.
That's interesting.
Yeah, and so I think that also another reason why.
We have to, I think, categorize what is the age at adolescent. I think for the people that are watching, so mainly teenagers, right? Like 12 to 13 to 18 or 21. That is what we say, because from 18 we say adult or maybe 21. So what she was saying, this brain development is very, very, very vital to understanding of how teenagers, how adolescents function. Like we said, there are 5 regions of the brain, right? Different, we call it lobes, or we call it cortex. So this part of the brain, right, this is called the prefrontal cortex, like she was saying. So this is where we make decision, that this is the higher thinking comes from here. So for teenagers, for adolescents, this part is is the part of the brain that develops the last. So that's why teenagers, you will see a lot of recklessness in them, because they do not have the capacity to look forward beyond the ramifications of it. If I do this like that, so yeah.
Okay, that's interesting.
So that's very technical. We need to understand this one. I have been approached by many people, in church, by parents, and say, "Nzan, please counsel my child. My teenage child. He or she is just, uncontrollable." And I tell them it's hormonal. I'll tell you this is that because of that.
Okay.
Please give them time. Don't be too much hard on them, because they are going through like literally physical changes in the body through hormonal change. So we gotta understand that. So being aware of all these things also makes you understand that my teenager is not really a demon, like he or she is just
there's a reason behind that behavior.
There's a reason behind this behavior.
I think all parents should take note of that, so that you will be better in treating your children in the correct
better
way.
Equipped,
Not sending them to prayer homes and like discipline them through prayer and all. Of course, it's important. But like I mentioned about prayer, do you like the fact that Christian values focus a lot on prayer when someone is in depression? How do you justify that? Prayer is important as Christians, as we believe, but how important it is, like totally avoiding the counseling part, consulting with a psychologist, counselor, rather than sending to a prayer home or a church? What do you say on that to our parents?
And I think very important first is now that we treat everything as one. Like, why do we treat our emotion as one, our physical as one, our spiritual as one? We tend to pigeonhole all of them, right? But we need to understand that all has to work together in synchrony. Okay, so the problem with what we see commonly is that we just go for prayer and we ignore the emotion, we ignore the physical, Prayer is important. We need to integrate that with everything together, right? And so I think I feel that is the essence of how to move forward, where to get, because I feel that we have just been segregating, and differentiating it. So prayer is important, but what we need to recognize we need to also recognize the mind issue, right? The thinking, like I said, the emotion, the behavior aspect of it. We need to understand that, and we need to address that alongside with prayer. Nzan, do you agree?
I mean, totally. So, there's nothing like Christian values. I mean, when you go through it, it's a very, lovely, values that we teach posterity and from our the older generations. There's nothing like Christian values. But when we say তাদের না যাবি pray করবি ভালো যাবো, right? So this is not because they are hubris, they are speaking in hubris or they are speaking in arrogance. It's because they don't know any better. They all older generations have not been taught like that. Prayer is very important. Pray as much as you can. Your connection to God, do whatever you can, but also seek professional help. That is what we want. There is a reason why we exist.
True.
There is a reason why we exist. There is a reason why prayers exist. So it's not when they say just pray, go to prayer house. In that thought, there is no hubris in that. There is nobility in that, because they are saying, okay, your connection to God is going to make everything better. But reality is that it doesn't work like that all the time. Sometimes you need to be human and human, like professionally human and human. I will go on to say this. Forgive me, everyone, but I will go on to say this, that there is a very big flaw in church counseling. Okay. Why do I say that? Am I speaking just out of nonchalantly? No, because I come from that background. I've experienced it. So there's a big flaw in church counseling than professional counseling. So we need to also know that counseling is most of the time listening, okay? And then church counseling does not happen that when you in church counseling, all they do is just pray, to not listen to the client and just pray and then let them, give them some Bible verse and then send them home. So there's a big flaw in that. So we have to understand that one also.
Yeah.
It makes a